Hi, this is Andrea Kane, and I'm here with you for HIT 330. This is now week 2, and we're moving on to chapter 2. In your book, if you look at page 43, you'll notice we're moving into part 1, System Foundations. That's chapters 2 and 3. This week, we're going to focus on chapter 2, Beliefs, Values, and Health. So if you want to follow along, please open your textbook to page 45, where we're going to take a look at our learning objectives. We want to discuss the concepts of health and disease, risk factors, and role of health promotion and disease prevention. We want to look at disease prevention requisites under the Affordable Care Act, public health and its expanding role in health protection in the U.S. and globally, which we have seen throughout the pandemic here, and determinants of health and measures related to health. Also, we'll be talking briefly about American anthrocultural values and their implications for healthcare delivery, justice and equity in healthcare according to contrasting theories, and integration of individual and population health. So let's get started. Let's talk about, at the beginning, the Healthy People Initiatives. These have been around for about 10 years, and these were undertaken by the U.S. Department of Health and Human Services, which is DHHS, and what they're trying to do is to make the overall population healthier. But they're also looking at the influence of anthrocultural factors, the evolution of health services, and the equity in the distribution of health services. If you're thinking about equity and health services and health disparities, one thing to keep in mind is that by moving healthcare documentation to an electronic platform, there suddenly becomes all sorts of data that can be used to compare, contrast, to add, to look and identify areas of lesser. And so that's one of the reasons why we have reached the point where we can, as a country, as a society, look at topics like cultural factors, evolution of health services, and equity. Significance for managers and policymakers. Well, the health of a population determines healthcare utilization. If you have a very healthy population, you may have less healthcare utilization, or you may have a lot more for preventative or wellness services rather than disease-related services. If you have an unhealthy population, you're going to see a lot of utilization of healthcare services for the chronic conditions, diseases, and challenges of that population. Another thing that they need to look at is how to design appropriate educational, preventive, and therapeutic initiatives. Evaluating the effectiveness of healthcare organizations is also important these days, as are measures of health status and utilization. Identifying trends. So let's talk about the basic concept of health. Health is the medical model defining health as the absence of illness or disease. So again, they're really looking at health being wellness, absence of illness or disease, or the state of optimal capacity. Oftentimes there's a biopsychosocial model or a holistic view that is taken into consideration when someone is talking about health. According to your book, according to your book, there are 4 dimensions of holistic health: physical, mental, and social, as well as spiritual. Together, those 4 form holistic health. In terms of quality of life, overall life satisfaction during and following healthcare delivery system encounters often result in conversations about quality of life. Quality of life may be an indicator of how satisfied a person is with their healthcare experience, or overall satisfaction with life and self-perceptions of health after intervention. So basically, quality of life is how satisfied is someone with their life, with their health, at a given time. Risk factors and disease. Risk factors increase the likelihood of developing a particular disease or health condition. And they want us to take a look at this epidemiology triangle where you have the host, the agent, the environment, and those three come together in determining disease. And in your book, that's at the top of page 50. Risk factors in disease, there are behavioral risk factors, and you'll see the list here. They did not put this in order of percentage of population, and I wish they had because I think it'd be easier to see some of what the trends are. But remember, they're pulling this data from 2014, which is essentially 7 years ago. With the number of states who have legalized marijuana, you may see that percentage change when these figures are updated. But these are what are considered to be behavioral risk factors. Risk factors can fall into three types of conditions: acute, subacute, and chronic. 3 reasons for the rise of chronic conditions include new diagnostic methods, medical procedures and pharmaceuticals, screening and diagnosis, as well as lifestyle choices. Health promotion and disease prevention. There are 3 principles of a health promotion and disease prevention program. They include health risk appraisal, interventions for counteracting the key risk factors, and adequate public health and social services. Your book does a really good job of laying these out, starting on page 53. Disease prevention under the Affordable Care Act. There were some things that came as part of the Affordable Care Act, like what we're going to talk about here. This is on the bottom of page 54 and going into page 55. The Affordable Care Act wanted to emphasize prevention and wellness. And so a couple of the ways they did that were through initiatives. One was the Prevention and Public Health Fund. Another was the National Diabetes Prevention Program. And then looking for ways to fund and establish and evaluate comprehensive workplace wellness programs. In terms of public health deals with promoting optimal health for society as a whole. They look at health protection and environmental health, and health protection, especially during global pandemics like COVID, protecting populations from a variety of old and new threats through global cooperation. Table 2.3 is at the top of page 58 in your book. It's leading causes of death. Now again, this was 2014, and they did do it from all causes and then breaking it down from greatest to least. And again, you have to remember this is 7 years ago, so this is what it was then. Health protection and preparedness in the United States. We deal with threats that require large-scale preparations. So there's tool and training for workers in medical care, public health, emergency care, civil defense agencies at federal, state, and local levels. And this is on pages 60 to 61 in your book. They talk about concepts like surge capacity, which we have heard about in the COVID pandemic. Determinants of health. Bloom's model of health determinants include 4 aspects: environment, lifestyle, heredity, and medical care. And they show you figure 2-3 on the World Health Organization's Commission on Social Determinants of Health Conceptual Framework. This is on pages 64 to 65 in your textbook. So you want to read through there and notice what they're emphasizing in terms of that figure, as well as Bloom's model of health determinants. Going on about determinants of health, contemporary models of health determinants include figure 2-4, integrated model for holistic health. Remember we talked about how it was mental, physical, social, and spiritual for holistic health? Well, they're looking at medical care, preventative services, social policy, and health promotions when they're talking about individual health to community health. Measures related to health include morbidity and mortality, and looking at demographic changes such as births and migration. Table 2-4 is the U.S. life expectancy at birth from 2002 to 2007 to 2014. And again, this information is about 7 years old, but you can see some of these trends when they broke it down by male versus female and some racial profiling. Measures related to health include mental health, social health, and spiritual health. And your book does a really good job of talking about this, just identifying the pages you're going to want to look at. I would say pages 69 through 70 are what you're going to want to look at here, about how measurement of mental health is less objective than mortality or morbidity, and about how measures of social health extend beyond the individual to encompass the extent of social contacts, including family life, work life, and community life. And it explains what Breslow's social health dimensions are. And then spiritual health has to do with a person's individual social cultural context, and moves into the spiritual dimension, and how to measure that has been challenging. Measures related to health services utilization, they've looked at crude measures of utilization, specific measures of utilization, and measures of institution-specific utilization. And remember at the beginning of this, I talked about how back in the day of paper records, it was very difficult to get an idea of trends of what was happening, because everything had to be abstracted by hand and submitted. And most people didn't even know what information to ask for. They simply gave what they thought was standard information. With electronic data, there's so much that can be mined, because all the data from all the patients that are cared for gets put into databases. And then there's all sorts of measures you can run to identify trends. And this is what's been happening. And this is how, excuse me, U.S. healthcare has evolved so far so quickly, is by sorting through the data, identifying trends, and determining what's meaningful and what needs to be acted on for decision making. So measures of global health, there are direct indicators of global health and indirect indicators. And your book goes through these. Let's see. Some examples include diseases, death, use of services versus social development, education, and poverty. So those are examples of measures of global health that are being accumulated. When we talk about anthropcultural beliefs and values, specifically what your textbook is trying to get at are the beliefs and values in the American culture. The U.S. is somewhat unique in its anthropcultural beliefs and values when it comes to healthcare and to health. One is we believe in scientific advancement and the application of scientific methods to medicine. There's a lot of emphasis on capitalism, even though there's not true capitalism presently in the United States. There are a lot of controls on that. The culture of capitalism promotes entrepreneurial spirit and self-determination. So that's why you see the great leaps and bounds in technology and in medicine and surgery happening in the United States. Principles of free enterprise and a general distrust of big government, although it seems like both of those have been eroded over the last period of time, and that we truly aren't a free enterprise system anymore, and perhaps a little less distrustful of big government in some ways. Equitable distribution of health care. There are concepts such as market justice and social justice. And again, I'm going to point you back to your book to read through what those are. You'll find those on pages 74, 75, and 76. Market justice is the fair distribution of healthcare up to that leaves it up to the market forces in a free economy. So medical care and its benefits are distributed based on people's willingness and ability to pay. Social justice is the equitable distribution of healthcare in a societal responsibility type way, best achieved by letting the government take over the production and distribution of healthcare. So they're contrasting concepts. And table 2-5, it's here, but it's very hard to see on the screen, so I'd encourage you to look at page 77 in your textbook. This lays out market justice versus social justice. And in the slide above, it said there are limitations of market justice, so you would want to be aware of that. In integration of individual and population health, again, we're talking about Healthy People initiatives. There's Healthy People 2020, where you look at measurement and achievement. If you are interested in reading more about that, which I would encourage you to do, pages 80, 81, 82 really go into the details behind what's happening with programs, policies, information, using determinants of health to try and improve outcomes, such as behavioral outcomes, specific risk factors, diseases and conditions, injuries, well-being and health-related quality of life, and health equity. And the topic areas for Healthy People 2020 is on page 83 in table 2-6. So would really encourage you to read through all of that. So in summary for chapter 2, medical model of healthcare delivery emphasizes illness rather than wellness. It's important to understand health determinants. What are they? How do they play a role in healthcare delivery? Healthy People 2020 continues its goals, and they're trying to advance those. And then the contrasting theories of market justice versus social justice. And what are the pros and cons with each of them? Because both of them do have pros, both of them do have cons. And that is it for this lecture video. I hope you have a great week. Talk to you again soon. Bye.